Something really big happened last month that we haven't yet had the time to pay close attention to on this show, but we must. In the UK, there was an independent review of gender identity services for children and young people that was commissioned by the Government Health Service over there, the NHS. It was headed up by a retired paediatrician, that's a children's medical specialist, and she's the former president of the Royal College of Paediatrics, in fact, a woman named Hilary Cass. The review was set up to look at gender services for children and young people, including those identifying as transgender. They handed down their final report last month, and the recommendations have had the backing of both the Conservative and the Labor parties in the UK, and they've been adopted by the NHS now. So, what did it find? And what are we doing in Australia? Well, it found that the people in charge of devising the approach by which doctors handled kids with transgender issues had not been subjected to the usual control measures. Children with mental illness, for example, weren't getting proper psychological support, and endocrinologists, the hormone doctors, were administering puberty blockers and did not go to meetings with other specialists like psychologists or other doctors to refine their treatments. They just operated as a law unto themselves. This is very damning stuff. It shows that all the things that they were telling us are perhaps not true. Oh, you know, these kids are getting the best psychological support. Nobody has an incentive to push them into hormone treatment and puberty blockers. Yeah, right. Well, that turns out to have been bulldust. They weren't getting the right mix of support or any psychological support. They were subject to an approach called affirmation care. Dr. David Bell used to be the governor at the NHS who had oversight of the clinic in the UK that was doing all this treatment. And he sounded alarm bells in his own report back in 2018. He explained what this affirmation care approach is all about.
Affirmation means if a girl comes along and says, I can't stand being a girl, I need to be a boy, you affirm that and agree. That's a totally inappropriate clinical stance. And Hilary Cass has underlined that many times. And that's an example of ideology, namely a kind of claimed human rights agenda, capturing what should have been a clinical domain.
And that is not good. It's very, very bad indeed, because it tosses out the rule book on how we're supposed to do medical treatment, especially when it comes to kids.
The ordinary canons of clinical care, the need to maintain neutrality, the need to maintain a certain distance, the need to take a holistic approach and think of a child in the narrative of their life and their cultural and social links and their family, all that was abandoned.
Affirmation care is like taking advice on whether to be vegetarian from a vegan. You know the answer before you even ask the question. But the most damning bit of the report was the finding that those in charge of the clinical approach to transgender kids felt, quote, under pressure to adopt an unquestioning affirmative approach, overshadowing other issues such as poor mental health. Oh my God. This makes me so mad. We're taking kids who think they are trans, not giving them any other kind of psychological care, and saying, okay, well, let's pop you on the old puberty blockers then, because, well, it's the politically correct thing to do. Never mind what's morally or ethically correct. Now, look, I believe some people have gender dysphoria. I guess it's hard to know unless you walk in their skin how it must feel to really believe that you're in the wrong body from the gender that you believe you are. But it's very, very, very rare, and this is a deeply, deeply complex issue that can't be solved by people with an ideology to push. And I just don't think we can do these treatments on kids, except in the rarest of rare cases. The approach must be that we can't let this become a social contagion or a fad among kids, that we have to be able to sort out the kids who really are suffering from those who aren't. And that can only be done with proper psychological counselling over a long period of time from someone who is not biased towards one ideology over another. And the decision must ultimately be made by the child's parents up until they are 18. Government, the state, has no place interfering in the primary family rights. Let's be very clear here. The final Cass report included several systematic reviews of scientific literature carried out by the University of York. The report states, when the review started, the evidence base, particularly in relation to the use of puberty blockers and masculinizing or feminizing hormones, had already been shown to be weak, and that after the examination over 100 pieces of potential evidence, that there continues to be a lack of high quality evidence in this area. In a nutshell, the report said that medical interventions are not the best way to manage gender distress in many cases. And where it is needed, it must happen with some psychological care too. Here's how the UK's Channel 4 News reported Hilary Cass's findings.
She said for most young people, a medical pathway will not be the best way to manage their gender-related distress. But for those young people for whom a medical pathway is clinically indicated, it's not enough to provide this without also addressing wider mental health or psychosocially challenging problems. She found that despite a considerable amount of published research in this field internationally, the quality was poor, meaning there's not a reliable evidence base upon which to make clinical decisions or for children and their families to make informed choices. She also said that there was weak evidence regarding the impact of puberty blockers on gender dysphoria, mental or psychosocial health, while the effect on cognitive and psychosexual development remains unknown.
Channel 4 actually spoke to Hilary Cass, and here's what she had to say about how political debate about gender ideology has been impacting care.
I think it's definitely the case that ideology on all sides has directed care rather than care being directed by normal principles of paediatrics and mental health.
Okay, so on the basis of no good science whatsoever, we've just accepted the ideology of gender studies academics at modern woke universities and powered forward with the idea that the way to treat kids who have gender distress is puberty blockers, hormone therapy, and in some cases surgery. That's quite a radical approach based on very little science. And even if it was the right approach for a very small number of kids, there's still a massive ethical question about whether we should be doing this sort of thing at all to any child, ever, regardless of the distress they may be in, that there might be better ways to help them cope with that distress. And we certainly need to involve people other than doctors in the treatment, like psychologists, for example. So whether you think medical interventions might help or not, we've jumped the gun big time, and we've been pushed to do so and shouted down by gender studies ideologues whose positions are emotional and political, not rational or based on science. And if that's the case, then this is a social shame of monstrous proportions that we all should be working to stop immediately. One journalist who spent a lot of time on this is former BBC producer Hannah Barnes. She wrote a book on it all a few years ago called Time to Think. The premise being that there were too many cases of trans kids reaching adulthood and then regretting that the path they took with puberty blockers and surgery was wrong and wanting to go back, but the damage having already been done. She spoke to Channel 4 about how puberty blocker treatment started at an NHS clinic in the UK and then went through the roof in terms of demand.
This service experienced an exponential growth in the number of young people being referred to it, children distressed around their gender identity, and at the same time had rolled out an innovative new treatment, puberty blockers, to try and help those children with that distress. Now, it started off well-intentioned. Here was an intervention that could seemingly help those young people, but they then started referring children for this quite new treatment for whom it wasn't meant for. And what's happened now is a doctor has come in and said, we can't continue like this. We don't do this in other areas of medicine. We don't prescribe powerful drugs without knowing that they're safe and clinically effective. And that's effectively where we are now. We're bringing in trans medicine, if you like, in line with the rest of healthcare, because it's not fair that this group of children who are very vulnerable and very distressed receive a poorer standard of care than anybody else should expect.
And let's just be really clear why this is happening, right? It's happening because of this woke ideology infecting and infesting everybody so that everybody's too scared to say, hang on a minute, we're going too fast here, we don't really have the science. Oh, you're a transphobe. You know, that's it. That's what's driving this. It's really, really sick. NHS England has responded immediately, shutting down its main unit responsible for setting the clinical guidelines, and puberty suppressing hormones are no longer being routinely made available in the NHS Youth Gender Services. New patients who might be assessed as being suitable for them will be required to participate in a clinical trial that's being set up to work out whether they actually do work, and more research is going to be commissioned into the whole approach. The Scottish Government has said that it'll take the time to consider the findings, and in the meantime will pause prescribing puberty blockers to children, referred to its special gender clinic. So what are we doing about it in Australia? A joint statement from Equality Australia and the Australian Professional Association for Trans Health didn't show any remorse or humility or concern. It just said the Cass review downplays the risk of denying treatment to young people with gender dysphoria and limits their options by placing restrictions on their access to care. What? I thought it did the exact opposite. I thought it said that the trans-focused medical community were the ones clearly not putting all the options on the table for kids and parents, and were instead driving them down one path of treatment by overemphasising puberty blockers and surgical intervention. Gee, I must have read it all wrong. Hilary Cass herself had a few things to say about all the reaction to her report. She says she copped abusive emails and had been told officially to avoid public transport. And she said this: if you deliberately try to undermine a report that has looked at the evidence of children's healthcare, then that is unforgivable. You are putting children at risk by doing that. She told the New York Times that her review was not trying to suggest in any way that trans people do not exist. That's absolutely not what we're saying. And there are young people who absolutely benefit from a medical pathway, and we need to make sure that those young people have access, but not assume that that's the right pathway for everyone. That sounds very, very fair and reasonable to me.